Welcome to OneMDHealth, where science meets soul. I'm Dr. Samiya Hashmi, your host. If you've ever been told that your labs are normal and that everything looks fine, this podcast is for you. When you still feel tired, when you still feel inflamed, when the weight does not come off, and you're not getting answers from physicians, this podcast is for you. I created this podcast for everyone to find the answers that they need in order to take control of their health. So I'm Dr. Samiya Hashmi. I am a board-certified internal medicine physician, and I'm also board-certified in lifestyle medicine. Although I do practice conventional medicine, I believe lifestyle medicine and functional medicine is really the way to go in finding the root cause and taking control of your health. So let's talk about the different topics of integrative medicine, and I'm sure everybody has heard of it. So we think of functional medicine, lifestyle medicine, regenerative medicine, longevity medicine, so many different titles. But do they mean the same thing? Or is it just a fad that is growing on TikTok, Instagram, influencers, health gurus? Who do you really trust? Well, I can honestly tell you that you can trust an MD that literally walks the walk and talks the talk. I came across lifestyle medicine back in 2020, but I've been living this type of medicine literally my whole life, ever since college in my 20s, to get through medical school, actually to apply to medical school, to basically study for the MCAT exam, and to definitely get straight A's in college. So I realized that to be healthy and to be able to survive college is you have to make sure you sleep well, you have to make sure you eat well, and you have to make sure you are around the right people that support you and love you to get through everyday life. So I got into medical school, and I spent 4 years of medical school learning about the human body. And then I learned everything about how to treat the human body. My first class in medical school was pharmacology. Pharmacology was all about learning the different types of drugs to treat disease. What can we do to combat cardiovascular disease? What can we treat to treat cancer? But did we ever really learn about what caused cancer and what caused cardiovascular disease in the first place? So as I moved on into medical school, after 4 years, I did my 3 years of residency training in internal medicine. And then I went off to become a hospitalist in general internal medicine, which I do still from this beginning, which has been about 18 years. Around 2020, when COVID happened, that's when everything shifted. That's when I realized that we are missing something in conventional medicine. Now, this is not a knock on conventional medicine. We need it. We need conventional medicine to save lives, to treat patients where they're literally almost about to die. Obviously, if I need to have my appendix removed, if I'm having a heart attack, I'm not going to want to go to a functional medicine physician to please just tell me to have a smoothie and get over it. No, that's not what this is about. Conventional medicine is very important. I save lives every day at my job, and it's extremely important in what I do. But what I'm trying to say is that it's incomplete. It is missing a huge part of how do we maintain and preserve life after we save it. And hopefully we never even get to that road where we have to save it. So during the time of COVID, when everyone had to be off from work, kids had to be homeschooled, including mine, I was on the front line of COVID treating patients when this pandemic happened. We were all very scared, all of us physicians, doctors that I was working with. What is this virus about? Who is it going to hurt? Who is it going to kill? None of us really knew that. And that really opened my eyes, because when I was taking care of patients during this time, I realized that the patients that unfortunately did die had a lot of chronic disease already either brewing in their body, or they had a history of cardiovascular disease, they had a history of diabetes type 2, history of obesity, history of cancer. Those were the ones that suffered greatly from this virus. And that really got me to thinking, well, why are we not addressing the root cause of these diseases so that when pandemics do happen and when the environment does change around us, we are ready to be equipped to learn about it? So that's when I decided to really focus on what kept me healthy during this time of COVID. I'm not saying I never got COVID, but thankfully I was able to survive whatever sickness I had in order to be able to save patients' lives moving forward. And when I looked at what I was doing, I impacted 5 pillars of my life that were important: mindfulness, meditation, making sure that I was aware of my body, of my surroundings. Number 2, nutrition, being able to eat healthy, eat right, just healthy whole-based foods. I was not on any dieting plan. I was not making sure that I had my macros and micros. I just made sure I ate real whole foods and cut out processed foods and sugar. Such a simple concept that we have not learned that in medicine. The third thing I did is made sure I got sleep, 7 to 8 hours of sleep every night. Fourth thing is making sure I was not around toxic people that put me down. And we are finding now that loneliness is a huge part of health. I made sure I surrounded myself with supportive friends and family. And the fifth thing that was also very important is cutting out risky substances. Now, I did not mean to eliminate alcohol, to eliminate smoking, which I do not agree with, never will be, but it's about everything in moderation. Then I came across lifestyle medicine, and they already had these 5 pillars in place. So I decided to basically research that more. And around that time, lifestyle medicine was not big as it is right now. Lifestyle medicine was just starting out, and it was founded in about 2012. And the idea is that your lifestyle habits could actually reverse chronic disease. So I got home every night after taking care of my COVID patients, and I would just be up all night, and I got board certified. I did all the CMEs in lifestyle medicine. And that's when things changed. And then I came across functional medicine. So functional medicine is the idea of figuring out your cellular biology. Lifestyle medicine is about behavioral changes. Functional medicine is about incorporating those behavioral changes, but also what's going on inside your biology. And what I love about functional medicine that really took me away was that everybody's bodies are different. We may all have the same complaints of fatigue, weight issues, digestive issues, sleep issues. We may have all those same complaints, but the treatment plan, the treatment protocols are all different for everyone because biology is different for everyone. Your genetic makeup, your cellular makeup will not be the same as anyone else's. So therefore, why do we have to treat everybody the same? This is where I find that healthcare needs to be personal because biology is personal. And that, to me, really had an effect on me as a physician, is that why are we treating everybody the same when we are not all the same? We all come from different backgrounds. We all come from different childhoods. We all come from different places on this earth. So why are we treating everyone the same? Why does one way always have to be the way? And it's not. So as I did my journey in functional medicine, I eventually found Green Circle Wellness, which is the clinic I currently work at in downtown Chicago. And what I found after working at Green Circle Wellness for almost about 2 years is that I see all different types of patients. I see patients that have come from different walks of life. I see males, females, older females, younger females, young men, all with same different types of complaints. I'm not feeling well. I'm told my labs are normal, but I don't feel normal. What actually is normal? Because I don't feel it. I'm not sleeping and I'm not sure why. I'm waking in the middle of the night. I have a lot of stress and anxiety. These pharmaceutical medications are not working for it. I know something's wrong with my body, but nobody's hearing me. So what I'm here to tell you is that you're not crazy and you're not wrong for feeling this way. And I'm here to let you know that you are just waking up in a healthcare system that unfortunately is broken. So let's talk about a little bit of our healthcare system. So we have insurance companies. So we pay insurance every month, about $400 or $500 more if you are not part of a W-2 or any other healthcare system. But what do we pay for that each month? We pay for 15-minute visits. We are paid for being put on medications that may have some side effects. I'm not saying they're not necessary. I prescribe these medications when I'm at the hospital. But why are we not discussing lifestyle change? Why are we not discussing nutrition? Why are we not discussing exercise, diet, sleep? Why are we not discussing, do you have supportive family, friends to help you through the day? How do you go about your day? Why are we not asking these questions? Because what I'm finding out is that this is the cornerstone of health. And this is why I created OneMDHealth. It is the idea of coming back to yourself. It is the idea where science literally does meet soul. It is the idea of stop being in the passenger seat of the car and start being in the driver's seat of your health. It is the idea of us coming back to one. So let's talk about how insurance companies, unfortunately, whether they realize it or not, have taken that away. When we have insurance plans, we have to be part of a network. So we can't see a certain physician unless they're in our network. So what does that mean exactly? So you can't really see who you want, but you can only see somebody where the insurance companies feel that they want to pay for. So you're already giving them that control. They decide who you see. You don't decide who you really want to see. And I'm not saying that's a bad system. It can work for patients that need to see a physician no matter what, but that doesn't give you the control of who you want to see. If you want to see the physician you want to see, you have to pay a PPO. Then when you do see them, and this is not to knock on my physicians that work in conventional medicine. I have a lot of physicians who are my friends. And like I told you before, we need our physicians in healthcare. But it's also about the fact that we are having this missing piece. And so you pay for the 15-minute visit. You get standard blood work done, right? Which is important, but it doesn't tell you the whole story. So you want to know about your thyroid, get a TSH level. But what happened to going more in depth in the thyroid, which we'll talk about later in this podcast. But just to give you an idea, in functional medicine, we go in further depth. How is your thyroid really working with your body? It is not so much, is your TSH in normal range? That does not tell you the whole story. Is your thyroid gland being converted properly to free T3 so you feel optimal, so you feel well? Why is that not important? So these are the things to ask yourselves, and this is where functional medicine came in. And who do you trust is really the most important thing. Who do you trust? And it's important to trust someone that has been in the medical field, that has seen the medical field, what it has done for patients and what it has not done for patients. For myself, being an MD for about 18 years of my career and being in the functional medicine world and treating all different types of patients from all walks of life, I can tell you this podcast will definitely guide you on your journey to medicine and to be an advocate for your health, which is extremely important for me. My mission is to educate you all to figure out, where do I need to make myself better? Do I need to work on nutrition? Do I need to work on my exercise? Do I need to work on my sleep? These are the questions you need to be asking yourself. Then the next questions you should be asking yourself is to really wonder what is going on inside my body. And where OneMDHealth comes in is to trust yourself, to come back to yourself, to come back and listen to your body, because there is a science behind that, which is really important. So let's talk about also what makes functional medicine and conventional medicine also different. It is the idea that conventional medicine deals with insurance companies and deals with hospitals, deals with physicians to help you in the acute setting. But what about figuring out basics of our bodies? So when I deal with my patients in my office, there are 5 things that I always focus on for their health. I focus on, first of all, their gut health. Gut health is cornerstone of healing. Our gut really is our second brain. So When we talk about gut health, it literally is the second brain, where our immune system is in our gut, about 70%. Brain health, important neurotransmitters such as dopamine, serotonin, all are important, lining our gut. So I always deal with gut health first. The second thing that I always also look at is liver support. Your liver is your foundational organ. Your liver is important for processing toxins. Your liver is important for getting rid of anything that does not belong into your body. So liver support and focusing on labs that focus on liver support is extremely important. The third thing that I also really want to focus on is nutrition. So when I go into nutrition, I really want to know about the lifestyle of my patient. What do you eat for breakfast in the morning? What do you have for lunch? Do you feel like you get enough fruits and vegetables in? And I know a lot of us in America are not, because I can tell you, I even myself struggle with that. But I think this conversation has to happen, is that your diet, your food is medicine. And it's not to be dramatic in any type of way, but what you eat can literally save your life. Whatever you put on your plate can literally save your life. Whether you put processed foods, sugary sweets, that will literally poison your body from the inside out. So that is a very important conversation that I have with my patient when they come see me, is what does your life look like? How do you eat breakfast? Do you eat it on the go? Are you aware that you need to get about 35 grams of protein with each meal? What type of protein do you eat? And do you make it a priority to eat? Or do you skip meals and go through your day just to get through the day? We're all guilty of it. I myself included am very much guilty of it. But it's about being aware. Again, the concept of coming back to one, coming back to ourselves. Where are we? It's about feeling centered, is really the idea. So the third thing I talk about is also I address basically hormones, because that's all they want to talk about, especially my female patients. Doc, I feel like my hormones are off. I know something's off. I think I'm getting older. I'm in perimenopause. That word is thrown around so much. But before you even deal with hormones, have we addressed gut health? Have we addressed nutrition? Have we addressed liver support? Let's address those three things first. So how do I do that? Well, obviously, I have a great conversation with the patient. My visits are not 15 minutes. My visits, the first visit is always 45 minutes, just sometimes an hour, because I really want to get to know my patient. What is really going on with you overall? What does your whole lifestyle look like? How do you go about in the day? How do you handle stress? How many times do you exercise? So that's 1 hour. So that is a big, important piece. When we get blood work done, we get stool testing done, we get all the, maybe sometimes I get salivary, urinary testing done, then we meet for an hour and a half, 2 hours. And this is when I go into all these concepts. And it's literally a genetic blueprint of where you are and who you are as a person, as your soul is, so to speak, which I think is so foundational. And that is where we're missing the most important piece, is where do we go from here after that? So as we address these certain issues, every plan is unique. A lot of times you don't even need hormones in the end. Sometimes you just need better nutrition, supporting your gut, which is so important, and also addressing nutrients. So my takeaway is that it is really, really important to trust yourself. This is what this podcast is about, is to trust your instincts and to not just feel like you're being gaslighted from the system. Okay? So here are my takeaway messages that I really want to say here in this first episode. First of all, thank you for listening. Thank you for being here. This podcast is to help educate you all in regarding so many different topics in functional medicine, lifestyle medicine, regenerative medicine, longevity medicine. I do pretty much do it all now, and I'm so grateful to be a part of this space to educate my patients wherever and whoever you are. And the idea is to let you know that you are not alone. I'm here on this journey here with you, and let's tackle it together and stay tuned. Thank you. Thank you for visiting OneMDHealth podcast. Please like and subscribe. If this podcast resonates with you, please share it to whomever you feel would benefit from this. If you have any questions, please visit my website, SamiyaHashmiMD.com.